Okay, hello everyone, and welcome to ATP Live Monday. I am Bemi Salaboide. I'm a pediatrician, and I'll be your anchor for today. Welcome everyone, whichever platform you're watching, and I want you to help us to share the video and invite your friends and family to join us. ATP Live Monday is a program brought to you by Ask the Pediatrician Foundation, where you can ask any question you may have about the health of your children and get answers live. So, thank you so much for joining us. And I'm also just going to make sure I share the video to everyone. Can see those of you joining on Instagram and say thank you so much for joining us today. Also just invite you to invite your friends, invite everyone who should be here, and let's just share the video. Um, and make sure everybody is aware. So we're going to do that for the next few minutes. Um, okay. Welcome everyone to ACP Live. So I'm going to celebrate. I'm just trying to share the video. Just give me a couple of minutes. But if you have any question, you can start to post your questions on our Facebook group. Sorry, on the video, as a comment on the video you're watching now, whether you're watching on Instagram or you're watching on Facebook or you're watching on YouTube, you're welcome to share and you're welcome to also post your question directly. And we just got a minute, 60 minutes to answer any questions that you may have about the health of your children. Just a few reminder for those of you who are joining us for the very first time, and even for the old timers. Please try and start every question with the age of the child. It's so important. And please, when you write the age, don't write a figure and tell us the child is 1, the child is 2. That makes absolutely no meaning. So you have to tell us whether it's 2 years old or 2 weeks old or 2 months old. We really need to know. Thank you. And please, if you're asking question about your child is small, the weight and all that, please try and give us the current figures. We always like to have uh, the facts that we can use to decide. For those of you who want to ask questions about rashes, unfortunately, you won't be able to post pictures, and unfortunately, without seeing a picture, it's virtually impossible to tell you what the rash is. So you may have to post your questions directly on our Facebook group because that's the only way we'll be able to see the rashes and we'll be able to give you an advice. All right. And usually I don't take parents diagnosis like varicella is measles is I won't take parents opinion about rashes because it's very easy for parents to call every rash um, the same thing, and so we like to say it first and then we can give you a professional opinion about it, not what the neighbors have said. All right, I think I'm done with all the sharing and I'm going to start answering questions, but I just want to make sure all the pictures are all the videos are pinned in the right groups so that people can easily see them. So please post your questions. Please drop your question under the video for those of you in the Facebook group, especially because some of you are dropping your questions under the pictures, the adverts. We won't be able to answer that. You have to put your question directly under the video because that's the only way we'll be able to say it. All right. So welcome everyone. Welcome. I hope you've had a beautiful day. I've had a beautiful one myself, and I'm happy to be here to spend the next 60 minutes just answering any questions that you may have about the health of your children. All right, so just one more sharing, and then we're good to go. Um, okay. All right. So I guess everybody is here now, and all the videos are pinned, and all the okay, and Instagram people, I can see you. Thank you. All right. So thank you everyone for joining us today. I am going to celebrate the like I said, here today to answer any questions that you may have about the health of your children, and I've got 60 minutes to do that. So start to drop your questions. I can't see any questions yet. Please, if you have any questions about the health of your children, start to drop them now, and then we can start to answer them. We've got 60 minutes, but if you have any questions at the end as well, you can still post your questions to our Facebook group, and we'll be able to answer them um, within 24-48 hours. We'll try and answer most of your questions. So even after the live session, and for those of you who are watching us after the live session, if you are watching a recording, you can always also post your questions on our Facebook group, because if you are watching a recording, you won't be able to um, we won't be able to see your question straight away. So you have to post it on our Facebook group, and that's the only way we'll be able to see the question, and we'll be able to answer them. All right, I can see some question coming through already. Instagram, I can't see any question on Instagram yet. So I guess it's okay to also just watch if you don't have any questions. But if you have any question, let's try and ask our questions on time, so that we will not have to wait till the end before we start rushing through the questions to answer them. All right, thank you. So let's start. What age can a baby boy sit with support? Okay, sitting with support is 5 to 7 months. Most children will start to sit with support between that age range, 5 to 7 months. By 7 to 8 months, they should be able to sit independently. And it doesn't really matter whether it's a boy or a girl. I don't know where we got that impression from, that the developmental milestones in girls and boys are different. Actually, they are not. And there's no special way to treat the boys. I do get a lot of questions about boys, about their sitting, about this, about that, and as if mothers are particularly worried about the boys when it comes to sitting or when it comes to milestone. There's no special anything about boys sitting compared to girls, and it doesn't really matter. So most children will sit by with support by 5 to 6 months. Whether they are boys or girls, and there's no special anything, and you don't have to force children to sit, and you don't have to teach them to sit. I see some mothers trying to make the baby sit as early as 3 months. They start putting them in this carton and other. Please don't punish the children, okay? Don't force them to sit when they are not ready. And even when they start to sit with support, it means you have to sit behind them, or you have to put like a pillow or something behind them. You don't just make them to sit and the children are almost falling down, and you don't leave them in that position for more than 5 minutes. So they are not meant to be sitting for a long time. You are just punishing the babies and stressing them. So you're supposed to sit behind them, just for them to rest on you or to rest on a pillow, and it's just for the first 5 minutes. After that, let them go back into their lying down posture and all that. So please, you need to be conscious of that. By the time they're about 7 to 8 months and they're able to sit by themselves, then you can allow them. And when we say sit by themselves without support, it means when they sit, their back is straight and they are not, leaning forward, and they are not trying to fall down in that process. So that's when they're able to sit. They sit and they're balanced and their back is straight. So that is how you know. I hope that is clear. All right, thank you, Ada, Winner, Doctor, how many months does it take a baby's eyes to be very clear? What do you mean by clear and become pure white? Baby's eyes are white from the time they are born. All right. So the white part of the eyes as is always white from day one. So it should not be any other color. So if it's another color, then we will worry about it. So if it is yellow, then that means baby has jaundice. If it is red, it may mean the baby has what we call um conjunctivitis, red eyes, what people sometimes call Apollo, but there's no medical word for Apollo. It is conjunctivitis. If it is which other color? Sometimes there's blood for newborn babies, when they are being born, sometimes through the process of coming through the birth canal, some of the blood gets into their eyes. So you will see that blood there. We call it subconjunctival hemorrhage. You can see blood there, which will resolve on its own. Sometimes the babies have brownish eyes, especially babies that tend to itch their eyes a lot. And we get that picture in babies with allergic kind of conjunctivitis. So maybe you can have green eyes. So actually for the older children, when they have this greenish, yellowish kind of eyes, we tend to see that in children who have sickle cell anemia. So that white part of the eyes is meant to be white always. So if it is another color, it is something and we need to know what it is. It's telling us something. And it's not necessarily, when we say white, it doesn't necessarily have to be like pure white like snow. Some babies have the type that's a little bit grayish, not necessarily completely white, but it should not be yellow, it should not be red, it should not be brown, it should not be lemon color or green. Any other colors apart from white, you have to see a pediatrician because we need to know what is that color telling us. So that is it. And it's from the time the babies are born, right from the beginning they are born. All right, let me be checking Instagram because Instagram questions can disappear. So let me go back to it's Facebook. Your questions are always with me. But the new method we are using on Instagram now. Facebook is, I don't think they've gotten it yet. The streaming method, the questions disappear. So let's just take a few questions from Instagram people. Ire Peter Diana. Sorry, I'm not sure I called that name properly, but just pardon me. My PCV in full block counts. Okay, you are asking, ma'am, PCV in full block counts and the capillary, which is accurate. Both of them are accurate. There's no difference in the PCV in capillary or the PCV in full block. I don't know what you mean by full block counts. So full block full block counts. What I think what you really want to see is that if we take blood into the capillary tube straight from the baby, like we do a pin prick, or whether we take the blood into a bottle, in which case it's a venous blood, and then we mix with some anticoagulants. You are trying to ask whether there's a difference between the PCV between the two. The answer is there is none. The PCV is still going to be the same, all right? Because even the blood sample we took into that bottle, when we want to do the PCV, we actually still put this in the capillary and then put it in the machine and spin it, and then we can read it out. So that is how we do PCV. So PCV, whether it's capillary, whether it's a blood sample, then it's still the amount of blood in that baby's body, and it's still going to be the same. It's not going to be different. So there's no difference there. I hope that is a question you're trying to ask, and I hope I have been able to answer you. It's just that for us pediatricians, why do we want to take 2 mils or 3 mils of blood from these small babies when we can just take a drop of blood? So pediatricians generally we favor the pinprick and taking a drop of blood for things like PCV and things that are not so very complex. So we just take a pinprick and we take the blood. But for things that are more complex, yes, we have to take a lot of more blood into the small bottles. And we have small bottles for babies compared to the bigger bottles for adults. So because we don't like to take too much blood from our babies. All right, Gifts Blessing, still on Instagram. Hello, doc. My 11-month-old baby hasn't bring out any tooth, okay? Excuse me, I'm a bit worried. You don't have to worry. There's absolutely nothing wrong with the baby not bringing out any teeth by age of 1 year. It's absolutely fine. So most things in medicine is a range. So things can happen early, things can happen a little bit late, but it's still as long as baby for us, we're not worried until baby is 13 months old. That is a maximum cutoff. So, and usually the dentist even want to see you and see your baby by the time your baby is 1 year old. So, once your baby is 1 year old, you should have or you should book the first dental appointment with the dentist. And so, but there's absolutely no reason to worry the fact that your baby does not have any teeth at the age of 1 year. It is completely fine. Dr. Nike, I can see you. Thank you for joining us on Instagram. All right, so Instagram people keep asking your questions. I'll go back to Facebook now. Um, okay, why did I stop on Facebook? Okay, stop with Ada's question. All right, so the next question is Shinaka Courage. Good evening. How do I get my baby to eat kitchen made food before she prefers only pap? Okay. Chinaka, I guess you were not here when I was saying when you want to ask any question, start with the age of your baby. Just so go back and ask that question again. And this time around, tell us the age of the child. So we will have a contest to which I'm talking about, and let us know what your child is even eating now. So because I don't have an age, I can't even begin to know where to start. So it's very important. Okay, Ada, you say what make a baby high, not white from birth? I think I've answered that question. I've already told you all the possible things that can happen. And so if you're worried about the color of the eyes of your baby, just take the baby to see a pediatrician. They will do the examination and they will let you know whether they are happy with the color of the eyes or whether they are not. A lot of parents are worried unnecessarily about the color of the eyes of the baby. There's absolutely nothing wrong with the baby's eyes, So it's best for you to see a doctor, let them have a look for you, and then it will tell you. I've told you all the things that we worry about. We worry about yellow color eyes, which is jaundice. We worry about red, whether it's conjunctivitis. We worry about green or yellow lemon green, which can be a sign of a child who has sickle cell anemia, jaundice as well. We worry about brown eyes, which we can see in children who have allergic conjunctivitis. So just see your doctors and they will tell you. For the newborn baby, it's either white or blood in the eyes or there is jaundice. Those are the most common three in that age group. What is the normal PCV for a 4-month-old baby? So PCV is a range, but at least for a 4-month-old baby, you want it to be at least nothing less than 36, not less than 36%. So what I'll recommend is that if you ever do any blood test, please don't interpret it. Take it to the doctors who ask you to do a blood test. And please don't do blood tests when no doctor has asked you to do it. I think we are becoming more and more, I'm becoming more and more concerned about Nigerian mothers and parents, especially. We have graduated now from just going to buy drugs, and now we've graduated to going to do tests without any doctor asking us. These are very wrong. These are very dangerous practices. So please don't take your baby to a lab and just do a test when a doctor has not asked you to do it. It is wrong. Let's stop putting the cards before the horse or say the horse before the cards. I'm always getting it mixed up. So anyway, but you know what I'm going. So the right thing for you to do is if a child is sick, you worry about your child, you take the child to a doctor first. Okay? A doctor has to see the child. And I know we do a lot of things in Nigeria because everybody just wants to make money. So the lab people just want to do tests. It doesn't matter. The pharmacy just wants to sell their drugs. It doesn't matter. In other places, or places where people know there is no more thing to do, a doctor has to ask for a test before it is done by anyone. It doesn't matter who you think you are. A doctor has to do the ask for the test first. A doctor has to write a prescription for medications that are not over the counter medication before it is before you can get it in pharmacy. But I know in Nigeria we do all sorts of things, and some of us are even taking it now. Some of us even want to ask us like, when I go and see my doctor, what should I tell the doctor to do? And I'm like, oh, I feel very uncomfortable when I feel so sad and I feel uncomfortable when people say that, because it means that you don't even trust that your doctor will be able to make the correct diagnosis or treat you properly. You need to ask another doctor to tell you what to tell the doctor. And I know it is not my responsibility to tell you what to tell your doctor. It's not your job to tell your doctors what to do. That is the doctor's training for 6 years to know how to do that. And if he cannot, the doctors also know how to refer the person to the next specialist. So that is how medicine is done. Please, let's start getting the right things back. Okay, so please don't do tests without the doctor asking you to do it. And what have I gone off tangents about that is that if you have done a test, then it is the doctor who asks you to do that test that should interpret it to you. Okay, I get a lot of questions, people posting pictures of the blood test, of the jaundice test, and you know me already, I don't interpret it. Number one, I cannot interpret your test without knowing the medical context, without knowing what is wrong. Why was this test even done in the first place? We don't just do tests because we like to do tests. There must be a clinical context, okay? And that clinical context will determine the interpretation. Okay, so if I just say, oh, the test is normal, but I don't know what are the other information before and after, it can be misleading. So you cannot do a test when a doctor has not asked for it. And if you have done a test when the doctor has asked for it, take it back to that same doctor, because this is that doctor that knows what he or she has in mind when doing that test, what he or she is looking for in that test. And that's the person that will be able to now tell you whether, okay, I'm happy or I'm not. So it's not just about it is normal, it's not normal, it is the context for which that investigation was required in the first place. So please, let's not do tests when our doctors have not asked for it. And if our doctors have asked for it, please take it back to that doctor. I know someone say, oh, the doctor is not going to be around. Ideally, if you do a test, that test must be interpreted that same day. All this issue of we do tests and actually for my babies, at least for babies, I don't know about adults. I think adults you can afford to wait, but it depends again. It's also depending on the doctors, what the doctor is looking for. So, for example, if I do a jaundice test, I do a serum bilirubin test, I want to see that result that day. There's nothing like it come back tomorrow, because I may need to put that baby, under physiotherapy lights. I may need to exchange the blood of that baby. I need to see that result that day. So, but if it's something like I'm just doing it because just to fulfill all righteousness, then I may not worry. So that is why your doctors will be the one to tell you when to come back and all that. But that doctor is still that person that should, or doctors who are working together in that same hospital, they should be the one to interpret the results. All right, let me quickly answer the question on Instagram before I come back. Okay, I think it's still gift blessings question, which we have answered already. Thank you, Idris Kasim. You say you're watching all the way from Kano. Thank you for joining us. All right, I don't think there's any question on Instagram. If your question on Instagram I've mixed it, please ask again so that in case it disappeared before I got that. Okay, so tell me, Hajayi, and my husband stepped on my daughter's finger. Oh my God, I'm sorry. That's so sad. How old is your daughter? They didn't tell us. Always tell us the age of the child. It doesn't matter what the question is. The age of that child is so important to me. So please always tell us the age of the child. But you need to take that child to the hospital. When did this happen? You didn't also tell us when it happened. It's also important to tell us the timeline of events. So you see something that just happened now 2 days ago, 3, it also matters. So I would expect that you should take this child to the hospital. Your husband stepped on the child's finger, it's red, it's bringing out water. That child needs to see a doctor. They may need to treat it. And parents, please be careful when you have children. Always monitor. Be careful where you put your leg. That should not have happened. Okay, Ada say my baby have 13 milligram per day of jaundice at 1 month. Again, Ada, you just asked a question which I just answered. So if you're number one, I don't do jaundice tests for a 1 month old baby. All right, because we don't expect a 1 month old baby to be having jaundice. Any jaundice lasting more than 2 weeks is what we call prolonged jaundice. Okay, so if the fact that baby is even having jaundice at 1 month alone is a worrisome thing for me, because it means this jaundice is staying too long. And the question is why? It is not even about the level now, it is about why. So these results have to be taken to that doctor who had to do the jaundice test. That doctor has to interpret it. Even the way you wrote the answer, that's not how we write jaundice results. Again, which is why I always separate. We need you to take the result back, because sometimes you don't even write it the way a doctor will write it. There's a way we look at it. And when we look at jaundice test, we're looking at 2 parts. We're looking at the total, we're looking at the unconjugated. Those things give us a lot of information. You have not even included that here. So, which is why it's difficult to interpret the results, So it's best for you to go back to your doctor, but your doctor needs to see your baby, because no baby should be having jaundice at 1 month. Your baby is still having jaundice at 1 month. The question is why, and we need to figure out the why, and then we need to address the why. And some of the why can be very serious. Some of them may require surgery. For example, babies that have biliary atresia, that means there's no connection. I'm not saying that's what's happening in your baby. Don't quote me wrong before you go and tell your doctor baby say, well, baby has biliary atresia. No, that's not what I'm saying. I'm just trying to say that there are some causes of jaundice that persist this long that will be a worrisome concern for any pediatrician. Some of them we need to do surgery, So it is important that you take this test back to your doctor and let them interpret it. I'm sure they must have done some other tests trying to look for the cause of this prolonged jaundice and try. Some of them there's really nothing serious going on, but some there's something serious going on. So that result has to be taken back to a pediatrician, not just any doctor, a pediatrician who will interpret it, who will look at all the information, who may do some other tests, maybe liver function tests, abdominal ultrasound scan, thyroid function. There's so many tests I will do in a baby who is still having jaundice at 1 month old, because I'm looking at the causes of prolonged jaundice, and that will determine what I will do depending on the cause of that jaundice. So I hope that is helpful, Heather. It's very important for me that that baby is seen by a pediatrician as soon as possible. All right, let's move on. Adeleke Teslim, 3-year-old son has muscle pull. Muscle pull. Children don't have muscle pull. What do you call muscle pull? So I prefer you tell me in a simpler word what you saw. Okay, just tell us what you saw. What is the child doing? Okay, is the child crying? Is the child shaking? Is the child stiffening? So just tell us what the child is doing. Don't tell me what you are calling it, which is the muscle pull you are calling it, but rather you tell me what exactly you're saying. Just try and describe it as much as possible in a simple everyday language. And if possible, if you're unable to do that, just do a video recording of it and let us say it, because it's important that we're sure. Babies don't have muscle pull. They don't. So I'm not sure what you're calling muscle pull, but it is not. We don't call it muscle pull in that age group, because they can't even tell you I'm having muscle pull. All right, you've seen something. I'd rather you tell me what you saw and let me decide what I think it is. All right. The guide section is no longer. The guide section is on our Facebook group. All right, it's there. Okay, so post this question on our Facebook group and they will tell you how to get there. But number one, you need to use a full Facebook app. Oh, I don't know. Okay, I can't show you my phone. If I show you my phone now, you will see it's there. But I'm using a background so you won't see my phone clearly. But let me give it a try. So you have to have the full Facebook app, not Facebook Lite. So it has to be can you see my phone? Okay, yeah, okay, I think you can even see my phone. All right, let me just remove my background and I'll show you what I'm saying. Background, let's move back to background. Okay, so this is my phone. The Facebook app you have to use. Can you see my phone? I don't think you'll be able to see it. It's a little bit too bright here, but you have to download the full Facebook app. And when you download the full Facebook app, if you go inside our group, because most of the issue is that you are not using the full Facebook app, you have to use the full Facebook app. If you go to the Facebook app, you go into the group, ask the pediatrician. I'm trying to go in there and I'm going to show you where you will see the guide session. So if you go into the group and you see just on the menu, I can see the guide straight as I'm looking into my Facebook group now. I can see just below the pictures and everything. It is just there. Unfortunately, it's too bright colored for you to see. Okay, yeah, I think it's better this way. Yeah, if you look at my face, you can see the guide. So those of you can say, yeah, exactly. I can see it. So that's the guide there. Is there? Is the first thing there. So you can see the guide section there. So there's no big deal there. It's there. So if you can't see it, that's the guide. If you cannot see it, yeah, can you see it? So, and I didn't even have to look. The most important is that you are using a full Facebook app. If you're not using the full Facebook app, you're using Facebook Lite, you're not going to see. You don't need to search for anything. Once you open your Facebook, once you get to our Facebook group, the first thing you will see is that you will see that is not difficult. So the problem is that you are using Facebook Lite or something else. If you're not using full Facebook app, you won't see it. All right. Let's go on. Okay, I don't have any questions on Instagram, so I'll continue with Facebook. Okay, I've answered this one. Patrick, what can make a 3 months urine to be smelling? When was the urine smelling? Is it immediately the baby passed it, or you've left the urine in the nappies for 3 hours, 4 hours, and then you're smelling? Any urine left for even for 30 minutes, 1 hour, it's going to smell. There's nothing wrong with urine smelling. It depends on how quickly you get the urine. So that's number one. And then the second question is, what is the smell? Okay, so there are certain smells of urine that we worry about. Most of them are described in English, British stuff, like maple syrup and all those things, ammoniac and all that. It's really difficult for you as a parent to know whether this smell is something significant or not. So, but number one, you have to make sure it's a fresh sample of the urine. Number two, if you think this smell is unusual, for example, if you're giving your baby antibiotics, like if you're giving them ampiclox and all that, it's going to smell the ampiclox. That is expected. But if you think this baby's urine is smelling unusual, you have to go to your doctors, your pediatrician. We will take the urine sample and we can smell it ourselves, and then we'll decide whether we're worried about that smell or not. So the smell is not even the issue. The question is, what is the smell like? Is this something that we expect, or is this something we don't expect? But don't rely on the nappies because for your 3 months old, most of the time they're passing the urine into the nappies, and you left the nappies for most of you 3 hours, 4 hours before you take it out. There's nothing wrong. Those kind of nappies are going to smell. There's no way they won't. So we're not worried about that. But if your baby is passing urine freshly, and then you think you are perceiving a smell that is unusual smell, it is possible. There are medical conditions that can give unusual smell. Then you have to take that your baby to a pediatrician. We will take a fresh urine sample, smell it, send it to the lab, test it, and then we can tell you whether we're worried or not. But if it is the antibiotics, you don't even need to bother, because that is expected, so that's what it means. All right. Okay. Okay, you're the one that asked about your baby not eating, taking only pap. Okay, no, Temi is the one that asks about your husband stepping your baby's finger. Oh, sorry, 11 months old. That's really painful. So you have to take that baby to the hospital. You didn't tell us how long ago it happened. 3 days ago, Abba, you have to take that baby to the hospital, because it means it is infected. If it is bringing out water, you have to take the baby to the hospital. Yeah, that finger has to be treated. I hope it didn't break any bone or cause any other damage, but you have to take that child to the hospital. All right, Adeleke, I'm always having pain in the upper right leg. Okay, you are the one asking about muscle pull. Okay, yeah, having pain. How old is your baby again? 3 years old. Number one, a 3-year-old should not be having pain at all in their legs, in their muscle, in anywhere. So this baby, you have to take to the hospital, okay? I can think of things that I'm worried about. Number one, I want to know the genotype of this child. We need to be sure this child is not having a pain crisis, which we see in children who are sickle cell anemic. That is the first thing I'm going to think about. We have to ask, has this child falling and hurt himself and you didn't tell? Children will not tell you, I fell, or somebody, maybe while running around with the other siblings or school friends, they can hurt themselves, and sometimes they don't want to tell you because they are scared you're going to shout on them. So we need to check, is there any fracture, is there any wound, anything? So this child has to go to the hospital. It is not normal for a 3-year-old to be having pain in his leg anywhere, upper, lower, anywhere at all. If you don't know what is causing that pain, you have to see us at the hospital and we can figure out the cause of that pain. But it is definitely not muscle pull and it is not normal. Gift Blessing, I've answered your question. You say you sent a question. I've answered your question like 2-3 times. You asked about your baby not having teeth. at 11 months. And I said there's nothing to worry about. When your baby is 1 year old, see the dentist. So I hope you didn't leave and come back, which is what normally happens. And I hope, just let me know if you've gotten my answer now so that I won't be worried. Unfortunately, that's how Instagram is. All right. Okay, let's move on. So Adeleke, please, that baby has to see a pediatrician. And there are so many other things as well that can cause those kind of problem with pain in the legs. In a 3-year-old, we have to see a doctor. We need to see a doctor. There are so many other issues. All right. Oshulano Hanoluapo Dunamis. What can I use for my baby's cradle cap? Cradle cap is on the head and outer hair. Number one, cradle cap is not on the outer. A cradle cap doesn't occur on the hairs. So cradle cap is on the scalp. So I don't even think you know what cradle cap is. So cradle cap is what look like dandruff, that will be coming out of, when you comb your beads here, you start seeing something coming out like dandruff, like that kind of a thing, or like something is peeling off on the scalp of the baby. Sometimes they look white, sometimes they look like black and all that. So I'll recommend, because you are not saying there's something on the ears as well, or is it HAIR you want to say instead of EAR? So I'm not sure. Anyway, I'll rather you send us a picture. Please put it on our Facebook group. Send the pictures. I can have a look at it quickly, and I'll decide whether it's cradle cap or whether it's something else entirely, and then we can give you advice, because I don't want to give you advice for something else. But for cradle cap, for example, you don't need to even do much. You just need to use age-appropriate hair shampoo, and then when you wash baby's hair every morning, you comb it out. You can also use things like olive oil or coconut oil to first soak the hair in the night, so that it will soak all those the flakes. It will make it easier for them to come off, so that when you now wash the baby's head in the morning using liquid hair shampoo, not bath soap, liquid hair shampoo, then you can gently comb it out and everything will just come off. And you have to do it gently so you don't pull the baby's hair along with it. That is the cradle cap. But I have a feeling what you are describing is not cradle cap, because you are mentioning the hair. So we need to be sure first before we give you the wrong advice. Obiago, Queenette. Good evening, Doc. My baby 9 months doesn't like baby food. Which one is baby food? There's no baby food, okay? Food is food, all right? So I know what you meant by baby food, of course. As a pediatrician, I know mother's lingo. So you think of things you go to the shop to buy that they sell to you in the tins and jars and all that. That's what mothers call baby food. Those are not baby food, all right? The food that your 11-month-old, your 9-month-old needs is the same food that you also eat, okay? The same rice, the same beans, the same veggies, the same everything you eat, and just your breast milk. So you don't ever have to go to any shop to buy any so-called baby food. So your baby is eating the swallow. That is what baby needs to eat. All you need to make sure is that when you give your baby swallow, you're also giving vegetables. Maybe it's a wedu, or maybe it's okra, maybe it's whatever. You have to give. It doesn't. Baby cannot be eating only swallow alone without fish or without meat, without vegetables. You have to make sure it's a balanced meal. At least having like four to five food classes together. And it's very easy to do that with swallow, because once you make swallow and there's vegetable soup, or whether it's or you had some fish or crayfish to it, that is 3 different kind of food already. And of course, you give the child water, or you breastfeed the child, or you give liquid milk. That's fine. So that's at least 4 classes of food that I've put together in just one meal. So your baby does not need to buy. You do not need to buy anything that they sell in the shops for your baby to eat. It's the same food that you eat in your kitchen that your baby needs to eat. All right. So it is lack of understanding and ignorance of what we call complementary feeding that makes mothers ask this kind of questions. I get it all the time, but it's because we don't understand what is complementary feeding. Of course, we have, if you go to our Facebook group, that guide session the other person was asking me about, if you go there, go to the guide session, go to the guides on infant feeding, complementary feeding, I think it's guide 2. You will see how to go about feeding our babies from 6 months old. The amount of food you need to give them, the texture and the quantity, all that is explained. And one thing I love about those videos is that you will never see them in that video use any of your what you are calling baby food there. Never. You will not even see a kind of formula, because your baby don't even need formula. Your baby needs your breast milk and the food that you have in your kitchen. What matters is the texture. So when you are starting at 6 months, it has to be semi-solid, soft, porridge like kind of food. But by the time your baby is 9 months, 1 year, then you can go to full solid. So you begin to increase the texture to be something, more quarts, more, ada and all that. So that's the only difference, but it's still the same kind of food that you eat every day that your 9 month old needs to eat. And your baby is actually helping you and saving you all the unnecessary thousand you spend buying the so-called baby food, which is just the same food you are eating that somebody has gone to the a laboratory or to the what do you call it now, like a manufacturing company, and they've packaged it for you and put it in a tin. It's still the same rice, it's still the same maize, it's still the same wheat. They put into powder, package it, and put some things inside, and they will sell it back to you much more expensive. Whereas if your baby actually eat it more natural, unprocessed, straight from the farm to your kitchen, it's far better. No preservative, nothing, which is better for your baby to eat rather than the one that you're selling in the store. So there's nothing wrong with your baby. And I think now you know better as a mom. All right. Okay, credit card question. I think we've answered that. Good evening. What can a new mom who is not lactating at all do? A new mom who is not lactating at all. Okay, congratulations to a new mom. I believe you still be in the hospital. If you are, it's like new, like delivering today. Okay, so that mom should be in the hospital, and I hope our nurses will help that mom to initiate breastfeeding. So what the new mom needs to do is to put our baby to the breast. Okay, that is how lactation starts. I get a lot of questions because people are waiting for the milk to flow so that the mother can breastfeed, whereas the breast or the brain is waiting for you to put the baby to the breast so that the milk will flow. The milk will only flow when the baby starts sucking on the breast. Okay, that is where we get to mix it up again. And that is why we need all our nurses and midwives to be back again, because we used to have what we call baby friendly hospital initiative, and these are some of the principles we teach in those baby friendly initiatives. That when the baby is born, the baby should be with the mother, no separation. The mother should put the baby to the breast within 30 minutes of delivery. All this time we waste bathing baby, wrapping baby, taking baby here, taking mother here. It's not necessary. Okay, baby does not need any bath after birth. Baby needs to be with the mother. Put the baby on the chest of the mother and let the baby start to suck on the breast. It is the sucking of the baby on that breast that causes what we call milk lets down. So because the process of milk flowing has to do with a lot of hormones, a lot of processes that are not even with the milk, that has to do with the brain. So the baby sucking on that breast starts those process of, that's what initiates that process. And then there's what we call oxytocin and all those things begin to work together, the hormones, and before you know it, the milk will flow. Okay, and then the milk that comes out first is not white, because this is a problem when people say, oh, the mother is not lactating, they are looking for white milk. You're not going to see white milk. What comes out first looks like water or like something yellowish. We call it colostrum. And it is so important that the baby takes that colostrum, because that is a baby's first immunization. It is full of antibodies, full of lots of agents that will protect that baby from all the infection, because that baby is coming out almost sterile, no exposure to germs, nothing before. So that baby doesn't have any ability to fight any infection. It needs the mother's, antibodies, and most of it is passed through that colostrum, through that breast milk, to protect that baby. So those are the things that people need to watch out for. So stop looking for white milk and stop trying to say the milk has to flow before the baby will suck. Let the baby suck on the breast. Don't look for the milk. Put the baby to the breast. Let the baby suck. As the baby is sucking, the milk will flow, and it's not white milk. So if you don't see anything white, don't worry, as long as baby is sucking. And then more importantly, that baby has to be properly attached to the breast. Okay, it is not the nipple. The areola is where the baby's what we call the milk dots, where the milk is stored. That's where the milk storage, the milk sinuses are. So when you put the baby to the breast, you have to make sure that that black part beyond the nipple, everything is in the baby's mouth. So the baby's mouth has to be open wide and everything. And for any mom, they need help. Our nurses or midwives, they can help them establish this process, because it's not always very easy and all that. But once they help the mothers get it right, so the milk will flow. So unless a mother who is very ill, like for example, a mother who has had operation, who is unconscious and is still in the ICU or whatever, then those kind of mothers, of course, the mother cannot breastfeed when mother is not with us, is unconscious. So then we can give what we call breast milk substitutes. The pediatricians know how to prescribe breast milk substitutes when a mother is not available. But a mother who is available, who is talking, who is opening her eyes, she should put her baby to the breast, and the baby will suck on the breast and the milk will flow. It's not the time to rush to buy formula, because I know that's the answer you're looking for, and that's not the answer. Okay, because when you do that, you actually going to stop that milk from flowing, because the process to start that milk flowing, you are neglecting it. That, and because once babies take formula or whatever, everybody is happy, and then later, mama, my milk is not flowing 3 days, 4 days, because we didn't do the right thing first. So that's why I'm taking my time. We do this all the time during our breastfeeding week, but we have to keep on reminding ourselves about all this information. Okay, thank God that Blessing has gotten my answer now. All right, so I hope Bola Shade, you know what to do now. There's nothing to do than for the mother to put the baby to the breast. That's it. Good day, doctor. Is it okay to give baby paracetamol before taking vaccines? No, don't give paracetamol before. You give it after, and only if the baby has fever. Some babies don't even have fever from immunization. They are fine. It's okay. You don't have to give them paracetamol, but if they have fever, yes, you can give them paracetamol. And please don't. I know there's a lot of fake messages or fake news. I don't know who started it, but this is a problem of social media. It can be good, it can be bad. And people were telling you that if you give paracetamol after immunization, then that means that the work of the immunization has been destroyed, or it's not going to be effective. Please, that information is false. It's not true. It didn't originate from the pediatricians or from the professionals. It is people, I don't know where they get the information from. There are a lot of people who claim to know much on social media these days, and please always check out the pedigree of people who you get information from. It's not everybody who is talking or saying something that actually are qualified to give you those information. So make sure you ask, who are you? What did you train? Where did you train? And all that. Seriously, it's important, because we're talking about health. We're talking about life and death here. So there's nothing wrong with giving a baby paracetamol if they have fever after immunization, and giving them paracetamol does not nullify or make the vaccine not to be effective. That is not true. Okay, please, we don't want the children to start having high fever and start having convulsions from fever. Please, it is completely okay to give paracetamol if a child has fever from immunization. And we expect some fever from immunization, especially 6, 10, and 14 weeks immunization. They tend to make baby have fever. Absolutely fine to give paracetamol. Give it every 6 hours for 2 to 3 days, and you'll be fine. Give some ice pack on the injection site. If it's swollen, just put some ice pack. Don't rub it. Don't apply kerosene. Don't apply close-up. Don't massage with shea butter. Don't apply hot water. Just ice packs. Gentle, intermittently. All this thing within 2 to 3 days, everything is gone. Okay? So I just need to quickly ship that in before uh, uh, somebody starts to because I know there are some other question that goes into that. So, okay, Folashade Oladokun, are you the one that just asked a question about the newborn baby, the new mom? Because you say your baby is 6 months, so you are not a new mom, or you're an old mom. Okay, your baby is 6 months, you're an old mom. Okay, your baby has refused to take water or any other food apart from breast milk. Your baby has refused. I think that was that's a bit strong for a 6-month-old. it's too early to say baby has refused. Number one, a 6 month old is just starting to take complementary feeds. That is when you are supposed to start. So I don't know whether it will be 6 months and 1 day, but you are just starting. So your baby is not yet refusing anything. The most food that this baby still needs is still breast milk, okay? So there's nothing to worry about. But what you need to do is the patience that you need. There's no rush. We're not rushing anywhere here. When you're about to start giving the baby new food, for a 6 month old, even if it's only 1 spoon of porridge or whatever pap the baby is going to take, that's fine, because we don't expect you to feed a bowl of food or a whole bottle. Please don't give them complementary food with bottles. Give them with a cup or with a spoon. And the quantity for a 6 month old is small, so start with 1 spoon is fine. Go on to 3 spoons, go on to 5 spoons. The problem is that most of us want to replace breast milk straight away with compliment. No, that's not how it works. So for that, you need to go to our Facebook group, and the other mom that asked about 9 months old baby as well, both of you need to go to our Facebook group. Go to that guys session I was trying to show on my phone, and go and watch all those videos on feeding your babies. What to feed them, how to feed them, quantity to give them from 6 months to 1 year, from 1 year to 2 years, what not to give them as well. That's why are you rushing to give the baby water? You don't need to rush to give the baby water. You don't need baby water after you're giving solid. Keep breastfeeding your 6 months old, and then you gradually introduce the solids. And it is too early. It's too early to say baby has refused. How many times have you given this baby food that baby is refusing? This baby is just starting complementary feed. So relax. Just chill first, okay? Because once you start having this, I would like it like anxiety, baby's refusing, because that one is very strong. It shows that you're already going to start getting worked up already, and then we're going to run into problem because you now become more anxious, and it's not going to work that way. Just relax. Baby is going to eat, okay? Breast milk is not going to be enough after 6 months. Baby is going to eat, but it's a gradual thing. It's patiently and gently introducing the food, and there's no rush to give a lot of food, because some of us that maybe take 3 spoons, you want them to take a whole bowl of pap. That is why you're saying baby is refusing. No, baby does not need to take a whole bowl of pap. Baby should still breastfeed more, and then gradually introduce other food. And usually for a 6 month old, just twice a day of solid, just twice a day. We don't need them to eat it 3, 4, 5 times a day. And then gradually you'll be increasing it. You'll be introducing variety and all that. And even the way you make the pap, it has to be thick pap. It has to be with a spoon, not in the bottle. You have to make sure it has taste. Some of you will make this pap, no sugar, no dates, nothing to sweeten it, and then you'll say the baby didn't take it. I mean, I won't even take it as well. So those are the information you need. So if you go to our guide session, because if I start talking on complimentary feeding, we will not answer any more questions today, and we have just 7 more minutes left. So go to the guide session and do those guide video. You are just starting, so no rush, no worry at all. Your baby is going to eat. Just relax. And I hope it's not your baby you're calling 6 months old. That is a new mom. You're not a new mom. You're an old mom. All right, Titi Lokpe, 4 weeks old baby stretches and groans, and it's not making him to sleep so deep. It is making him cry a lot at night. Okay, Titi Lokpe, you sound to me like your baby has colic. Baby that cries a lot at night for absolutely no reason sound like colic, and that is fine. This is a common thing for babies to have colic. There's no reason to worry. Just calm, learn to comfort them, make sure they're sucking, make sure they're not taking too much of gas hair when they're breastfeeding, because that's also make them uncomfortable, because the process of bringing out the gas makes them uncomfortable. Can rub their back. If you go to our website, we have a lovely article on what to do with infant colic and how to soothe the baby and all the things you can do. Most of them outgrow it. By the time about 3 months, they stop having colic. It's one of those conditions that we pediatrician will say, and it shall come to pass. When the Bible says, and it's come to pass, and it's come to pass. So when it comes to colic, it's one of those conditions that it shall come to pass. After a while, to go away, you will not even remember to look for it anymore. So don't worry, just relax. Keep breastfeeding. When baby is crying, get help, get other people to help you with carrying the baby. It's a rite of passage. Most babies have colic, and it will stop after a while. It's nothing to worry about. If you are really worried about it, you can see us. We can give you more tricks. But I think if you go through our website article, we have lots of tricks. So maybe likes when you move them around, that's why these grannies, they like to bag the baby and then they dance around. Babies love those movements. Some babies like the noise, the white noise and all. So different things. Some babies will give them things like Infocor, sometimes it helps, sometimes it doesn't help. So there are many things. We just try out these various tricks. But the good news is that most babies will stop having colic by the time they're about 3 months old, and that will be the end. So don't worry, just hang in there. All right, Idara says, maybe has rashes on his hand. Da, da, da. Okay, so rashes, I need to see rashes. There's really no point. I cannot answer a question on rashes without seeing it. It's one of the things we have to say. Pseudo cream, I don't know. I get okay, let me not say, but it's one of my pet peeves. I get upset every time mothers talk about pseudo cream not helping with rashes. Pseudo cream is not a treatment for rashes, okay? Pseudo cream is a what do you call it? It's an nappy, it's a diaper cream. It's meant to prevent baby from having diaper rashes. It is not treatment for any rashes. The same thing with Tributan, because people ask questions about rashes and they were like, oh, I've used pseudo cream or I've used Tributan, as if once you use those two products, every rash should magically disappear. I'm sorry to disappoint you. It is not true. Okay, so they are not supposed to be treatment for any rashes. So stop bothering yourself about that. The most important thing with rashes is that we have to know what type of rash it is and what is causing it. Okay, if you can't answer those two questions, you cannot treat a rash, okay? Some rashes don't even need treatment. It's as simple as stopping what is causing the rash. For example, maybe it's the cream you're using, maybe it's the soap you're using, maybe it's the food you're giving the baby. Maybe the child is just reacting to something. And all we need to do for those kind of rashes is stop whatever the child is reacting to, and the baby is fine. We don't even need to treat any drug with any drug. So that is number one. Then some rashes are due to fungal infection. Pseudo cream is not an antifungal product. It's not going to take care of a fungal rash, for example. Or some rashes are due to a bacterial infection. It is not an antibacterial, so it's not going to take care of it. So the treatment of rashes depends on the cause of it. So stop. I always tell mothers it's best to do nothing than to do the wrong thing. So it's best if your child has a rash and you don't know the cause, you don't know why, just don't do anything. Just do nothing until you see your doctors and will tell you what to do. Because sometimes in the process of trying to do something and using all the recommendation by our friends and neighbors and experienced mothers, we make the rashes actually worse. And some of you are honest enough to say that you notice that when you use what they recommended for you, the things became worse. It even spread more. So please don't. And now you want to graduate to magnesia powder, coconut. Just stop everything, okay? Use whatever you've been using before, your coconut oil, that's fine. But let us see the rashes first, okay? And then we can tell you what to do. All right. So stop pseudo cream, stop magnesia powder, stop every other thing else. Let's see the rashes and we can tell you what to do. And some of you worry that, okay, because, as pediatrician, we normally recommend that use hypoallergenic products. Some of you are using Sebamed, you're using shea butter, and your baby still have rashes, and you're like, as if, why should my baby have rashes because I'm doing the right thing? Your baby can still have rashes for many reasons, okay? So when we say use Sebamed, use coconut oil, use shea butter, those are products that your child will not likely react to. So your child is not likely going to have an allergic kind of reaction to those products. But your baby can still have rashes from other reasons, okay? So if your baby is exposed to people who carry the baby without washing their hands, all their hands are full of germs, and the next thing, everybody, Africa, new baby, bam, carry, some of them will even kiss them. The baby is going to have infection from all those people's hands touching the baby. Or some of us, you just put your baby on every couch, every places, and some of those places are full of spores of all this fungal and everything. Your baby is going to have fungal rashes from those places. So there are other causes of rashes that have nothing to do with the fact that you are using coconut oil or you are using shea butter or you are using Sebamed. Okay, there's still infection. And some babies actually have very sensitive skin. Some babies have this atopic dermatitis, which is something genetic. That's how they had their skin is so sensitive. Even just maybe it's the soap or anything you use on them, their skin will just break out in rashes. So you have to know all that. So don't always feel like my baby cannot have rashes because I'm doing the right thing. No, your baby can still have rashes because there are so many causes of rashes and so many reasons. So, but the most important thing is for us to say it, and then we can advise you basically on that. All right, my time is up. I'll just answer the question already here. Other questions, please post to our Facebook group. There is a 6-month-old baby cannot add formula and glucose to his pap. He's not taking pap or custard, and I'm still breastfeeding. So okay, you can add formula. You don't have to add glucose. Just use the normal sugar if you want to make it just to taste. It's not to make it a sugary solution, okay? But more importantly, if there is, please go to our Facebook group, go to the guys section. I think I've talked a lot about complementary feeding. I really want you to understand complementary feeding, because complementary feeding is not just pap and pap only or custard. No, there are so many other food your baby can eat. There are so many other food you can give your baby, including mashed potato, mashed yam, including other things. So, and it is not compulsory for babies to take pap, because a lot of mothers ask me that question a lot. Like, my baby does not take pap. It's not written in the constitution that baby has to take pap, and it's okay if baby doesn't want to take pap. Pap is just a source of carbohydrate. There are many other things that can replace pap. Your rice, your potato, your yam, everything, sweet yam, sweet potato, Irish potato. There are all sorts of carbohydrates which your child can eat. So it's not written in the constitution of Nigeria that babies must take pap. They don't. It's just that it's one of the easiest things to give. And there are many, even the pap itself, it doesn't have to be maize pap. You can do wheat, you can do so many other guinea corn, everything. So you have to experiment. You must be willing to try different things. And there are so many other things. Even all these fruits, carrots, all those things you can blend and you can give your baby. There are people that have websites or social media handles that are devoted to giving you recipes for babies. Please use them. I mean, that's not my job as a pediatrician, but we have nutritionists, we have other mothers that do all these babies food recipe, and I'm always impressed with some of the all the kind of things they come up with. And so babies like some of those things better, so even like somebody said, baby like swallow. Not just stop your baby from eating soft amala, soft semo, and you just make sure you have vegetables and all that. It's the same food. It's just that when you are starting, it has to be very soft, semi-firm, not hard like apple or anything like that. So fufu, but when they get to like 1 year, 2 years, and hey, you can begin to do those ones. So it's still the same food, but it's just the texture, soft, semi-firm. Then as they get older, you go to things that are harder and more solid and all that. But please, you don't always have to do pap and custard. It's not compulsory at all. And if baby doesn't like it, that's fine. Try something else. And it's not only one food. Baby have to eat variety of food. That's another key principles. Some of us want our baby to eat pap all day. I think one mom was asking us that question, though she didn't come back with the follow-up of that question when I asked for the age of the child. Let's start from that 6 months to start giving them variety, because if you wait until they are 1 year, 2 years, then you're going to come back again and say, my baby only wants to take pap, or some is only tea and bread, and baby doesn't want to take other food, because we never tried them when babies were younger. So that's why it's important for us to watch those complementary feeding videos, understand the principles, and then we can follow it. I hope it's helpful. All right. Okay, so I'm always confused. You asked about a 6 months old, you also asked about a 3 weeks old. Is it your same baby or you're asking for somebody else? Because that's a little bit confusing to me. It's 3 weeks since she gave birth. Okay, you're asking for somebody else. Yeah, so 3 weeks and mom is not lactating. It is because you people have been giving the baby formula, because you've been feeding the baby for 3 weeks, obviously. So you've been giving the baby formula, which is the problem with giving formula. You actually, breast milk is demand and supply, okay? If you don't demand for breast milk, it will not be produced. Once you start giving that baby formula, you stop demanding on the breast, because you even forget to put the baby to the breast, because everybody is just giving formula. The grandma, they love it because they don't have to bother the mom, because the only thing only the mom can do for your baby is the breastfeeding. Nobody else can breastfeed that baby except the mom. So once people start giving formula, you stop demanding the breast is going to dry up. That is as simple as that. It just takes it that I am not necessary, the breast milk is not necessary. We shut down production. It's as simple as that. That's what normally happens. So, which is why that first hour of life is so crucial that we establish breastfeeding. It must be established within the first hour of life. Once you miss that opportunity and you continue to miss it, that's it. That's not going. But you can still start now, because the solution is to still go back to what I've just said, which people have not done, because it's still the same solution. You still have to put that baby to the breast. That baby has to suck on that breast. But what normally happens is, at this point now, you have introduced what we call nipple confusion. This baby is already on bottle, is on formula with the bottle. The baby doesn't want to suck the breast anymore, because baby felt this is it's much hard work. Whereas that one is easier. Bottle feeding is easier because the milk is just dropping, Whereas breast, you have to suck it out. It's work. That's why baby sweat when they suck. All right. So, but the solution is this: if you still want your baby to breastfeed, put the baby back to the breast and stop that formula, because that's the only way the baby breast is going to flow. 3 months is not too far. The baby can still produce, the mother can still produce breast milk, but that's the only solution. That's the only way forward. Okay. So I'm especially emphasizing this for the new moms and those who are still going to have more babies. Please let your baby start sucking in the first 1 hour. And I don't care whether you have CS or not, you can breastfeed your baby, even with cesarean. Because most cesarean these days, we do it on the back. So you are awake. We do a spinal anesthetic. So you are awake. Put the baby to the breast. Let the baby suck. That's the most important thing. All right. Every other thing else other people can do for you, but you are the only one that can breastfeed your baby. And once you don't put that baby to the breast, it's much more difficult the longer it takes. And because your breast starts to dry up, and your brain starts to send a message that I don't need to produce breast milk. It is not necessary. And that's why some of you, within 3 or 4 months, the breast is completely dried up. It's because of the mixed feeding and the failure to initiate that breastfeeding from the first hour of life. It is so crucial. That 60 minutes, golden minutes, it must not be missed. And our nurses, I plead with you, please let the mothers breastfeed. All these days, everybody just wants to make life easier. It's easier to just mix formula and go away and affect the baby. Whereas the best thing is for that baby to be put to the breast. So let's go back to the baby-friendly hospital initiative. That's the best. And now, Nigeria economy is not smiling. So everybody, I think we are going to go back to breast milk now. All right. Can one give vitamin C daily? No. Give your baby fruits. Let them eat a banana. Let them take oranges. They don't need to be taking all these tablets, honestly. Natural better. Goat milk, cow milk, none of them is okay for an infant. Let the infant take their mother's breast milk, okay? Goat milk, infant, cow milk, we don't even want any. Let them take human milk. Human milk is the best. From 1 year, your baby can take cow milk anyway, or goat milk, anyone you like. But for the first year, we want them to take breast milk, human milk, preferably. Complimentary video. Just ask that question in our group. You can't miss this in our group. Even on this Facebook page that you are now, go to the video section. Some of us don't know how to use Facebook. Unfortunately, that's not the job of a pediatrician. But if you go to our Facebook page, which you are now, because you're asking this question on our page, go to the menu aspect where they normally put all the different aspects. Look for the videos. So the videos are there. All these videos are there in our video section on our page, which you are now. It's also on our group. If you ask this question on our group, somebody will show you how to go there. So I mean, they are there. They are there. Maybe you are okay. I'm trying to see if you say complimentary feeding, maybe it's not going to just write feeding videos or something like that, or just ask on our group or go to the video section and look through all our videos. You will see that it's there. Don't worry. Last video, can maybe stop breastfeeding at the age of 1 year? Well, you can if you want to, but we recommend 2 years. But obviously, we can't force you. At least, if you do 1 year, it's still not as it's better than nothing. At least some people didn't even do any at all. So, but if you can do 2 years, better. I just want to appreciate you. I learned a lot from. Oh, thank you, Joanne. God bless you. Thank you for your kind words. Good evening, Olayinka. Okay, Oshuna, no. no, dunamis. Are you related to the folate? Okay, no, I didn't know they're not. After the I was placed on strong antibiotics, I was told not to breastfeed. That's not true. I don't know which antibiotics will mean you cannot breastfeed your babies. Most of these things are private hospitals, honestly. I don't know which antibiotics. I know. Tell me the name of the antibiotics, and I will tell you straight away whether you can breastfeed or not. And you can always go and check it out because everything that unless you are on anti-cancer drugs, I think that's about the only drug that will tell you not to breastfeed. If you're on medication for chemotherapy, but most of these other drugs you can breastfeed your baby. Even this day we give babies ciprofloxacin, even as newborns. So why can't you breastfeed? So some of those are old school method, but most of these drugs you can breastfeed your babies. Honestly, I don't buy that. And why do you need to take antibiotics for 2 to 3 weeks? Again, that's again red flag. Yeah, I don't know. The mothers don't really take antibiotics for 2 to 3 weeks. For what? What are we treating here? Because you are obviously you are awake, you are not unconscious, you are not in coma. So why are you taking antibiotics for 2 to 3 weeks? You know. So what I would say is that for you, I don't know which hospital you have. There are many things you're saying, and number one is raising red flags. Why do you need to be on antibiotics for 2 to 3 weeks? What is the name of this antibiotic? Again, why do you need to take for 2 to 3 weeks? What are they treating? It's very unlikely. So anyway, you are now, if you are okay now, please put your baby to the breast. You can still breastfeed your baby. Yes. Even mothers that were not pregnant, we can make them breastfeed. Yeah, we can. We can do it. It's a lot of work, but we can do it. How much more you that you had your baby by yourself? So put the baby to the breast and let the baby suck on the breast. Okay. Let baby suck, not express. Put that baby to suck on that breast. That's the only way the milk will flow. Okay. That's the only way. And the more of the breastfeeding and less of the formula you do, because obviously you've been doing a lot of formula, the better for you. So let the baby suck on the breast directly. Okay. Why is baby of 20 months hyperactive? How do you know your baby is hyperactive? I don't know. You have to tell me what baby is doing before I can agree or disagree. Well, I have a feeling there's nothing wrong with the baby, Sha. But if you tell me more information, then maybe I will see what you're talking about. But can your baby talk? That 20 months or the baby talking and all that? So this baby praying with other children. I'm more interested in that than the hyperactive. What cream can a CS mother use? Whose sky is forming kilos? I'm not a adult doctor, okay, but I'll recommend that you go see your doctors who operated you, and they will tell you what cream to use. If you are developing keloids, there are actually doctors that treat keloids, and they will be able to tell you what products to use. All right, so babies don't vomit, so don't generalize things. What makes babies vomit these days? That is too generalistic. Say number one, not everybody's baby is vomiting. Okay, let's start with that. And so if your own baby is vomiting, we need to know why, and so we have to go to the hospital. There are many reasons why babies can vomit, but the way you say it sounds as if it is something baby should do. Baby should not be vomiting. How old is this baby? What is baby vomiting? What are you feeling in baby? Baby having fever? There are so many questions I want to ask before I can answer your question. So there's really no point to start. So, but if your baby is vomiting, it is not normal for a baby to vomit. Take that baby to the hospital. But you didn't tell us the age of the baby. So I really want to be sure whether the baby is having reflux. They are calling it vomiting because sometimes mothers use the same word for the same thing, but it's not the same thing. All right. Levofloxacin. I know it has to be something like ciprofloxacin or any of, but these days we actually give our babies even ciprofloxacin, and even for that, there are alternatives they can give to you that you can still breastfeed your baby. And I think that is what the doctor should be considering, unless you're saying you are developing resistance and all that. Which anyway, but I just know that that's okay. The baby is talking well, good. I'm happy with that. She doesn't sit in one place. I mean, okay, there's a level of movement that we're expecting it in a 1 year old, in a 2 year old. That is normal. I think it depends on your own temperament. If you are the kind of person that likes calm and peace, if your 20 model likes to walk and move, then you will think it's hyperactive. But there's a level of walking and moving around for a 2 year old that I'm not going to worry about. So anyway, we don't worry at this age, Chada. Just let the baby run around. Just make sure the baby is safe. That's the most important thing. Let the baby safe. Okay, can a pregnant mom breastfeed a 1 year old baby? Yes, you can. Left to me, you shouldn't be pregnant when you have a 1 year old. We want you to stop breastfeeding before you get pregnant. But now that you're pregnant, if you want to breastfeed, it's okay to breastfeed. But if you also want to stop, it's okay to stop. I mean, your baby is 1 year old. You can. I hope the baby is eating other food, so you can stop as well. It's up to you. Do what works for you. So that's fine. Yeah, 20 months old baby. I've answered your question. I know 20 months is still up to 2 years. It's 1 to 2 years. It's okay. So there's some level of hyperactivity we expect in that age. Not hyperactivity. There's a level of activity we expect in that age that is normal. We don't expect a 2 year old, a 1 year old to sit still. They are not going to sit still. Okay. It's okay for them to run around. It's okay for them to play. It's okay for them to do that. So I think we worry if a child is not sitting in a situation when we expect other children to sit. For example, let's say you went for birthday parties and all the other children are sitting and you know, but even the most 3 year old, nobody expect that. I think they're about 4 or 5, yes, we expect them to start sitting down and following the teacher's instruction and learning. And if the child is now walking around and doing all that at that age, when all the other peers are sitting, then that is when we will take it as hyperactivity. But a 1 year old, I'm not worried at all. So let them move around. As long as there are no other developmental concerns, which is why I asked, is the child talking? Is the child playing with other children? Is the child responding to instructions and all that? If that is going on, I will not worry about that. All right, my time is up. I need to go. Thank you so much for joining us. And if you still have any questions, you have to post your question directly to our Facebook group. I'm sorry, I'm going to take any questions already more than 15 minutes after we start our normal time, cut-off time. So unfortunately, Damilola and the rest of you, you have to post your questions on our Facebook group and we will be able to answer it from there. I'll continue with my question and answer on epilepsy. Unfortunately, there were so many questions I couldn't even scratch the surface of it last week. So I decided, okay, I'll do part two because I know those questions are very important to a lot of our parents. So I'm going to do the part two of question and answer on epilepsy on Thursday, 10 a.m. Nigerian time. Don't miss it. And after that, every Thursday, you can always watch a teaching episode, and I think we'll do something on cancer in children as well. Yes, children can have cancers as well, so we'll talk more about that. So thank you so much for joining me. I appreciate all of you. I appreciate all your questions, Instagram people. I appreciate you all. So if you have any questions or you are watching this as a recorded episode, no, it's no longer live. If you are watching anything after 7 p.m. on a Monday, you are no longer live. So please go to our Facebook group, post your questions there, and we'll be able to answer your question. Thank you so much. God bless you. Have a wonderful evening. Bye.